Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I'm going to talk to you about an adult doing adult orthodontics on a teenager. You have young people that have difficult orthodontic problems, and they're very difficult. So you need to learn how to do this adult orthodontics, and you have to mix that with some restorative person or something of that nature, and sometimes an old surgeon along with that. So it's a whole team of you work on a person. And this is kind of what happened with this young man right here we're going to talk about. And so let's go ahead and get going here. I've got a lot of stuff on him, and he grew up here in this beautiful little town of Glen Rose, Texas, and came back, and I'll just tell you, he became the sheriff of the town, and this is several years ago while he was a teenager. And so he is missing almost half of his teeth in here. So this was not a play thing to start doing. So I worked with a restorative person, and you look at this like this, maybe nobody would want to tackle a case this way unless you've really been into orthodontics for a good while and you know how to do most all of the things about it. So anyway, this is the way it looked. His bite was like that. And so we're going to have to go in there, and he's got a whole host of deciduous teeth. And what we actually did was get rid of the deciduous teeth and put the permanent teeth that were in their correct positions. And then he had completely bridge work, which covered his whole mouth virtually. So let's get with this here. And if you do something like this, you have to make the bone structure up above fit, so you have to spread it out a little bit, and then you of course x-ray it, and we have to level the arches. And so we use these bonded blocks. We've talked about them so much. We open that up, and we've got an intruding arch wire coming on here. I'll try to explain it to help. And this is leveling this anterior part here, and it's kind of keeping this block on the side in the back here that keeps this from getting the vertical height of the face even more. If you didn't have those blocks and you push down on this, it'll push up just as much on the other side, and you will open whatever the teeth move up or toward one another. You open the bite, and maybe you don't want to open the bite, and so you put these blocks back in here, and that's why we've got them. And they will not let it open in here, and yet it will intrude what teeth he's got here. So we had to level this out and get some arch coordination before we got into this. And we started this in the last month of 1989, or I guess we've been in it for a little while when we got to this point. And this is leveling the bite out. So that's done on anybody, and so you can know how to do that. And we took these blocks. This looks like an odd looking block in here. He's biting on this and that area. So it'll bring this part down, and this will not go up hardly at all, but these teeth will come around and level out in this fashion. And now we're moving the teeth, the permanent teeth, together in different places in the mouth. And so we're going to put them where they should be, and then we work with a restorative person, and he'll come in and make bridge work for the rest of it. Now we put him biting in this anterior part of the mouth right here, and now this leaves this open, so we're going to let the bite kind of increase the vertical height of this lower third of the face a little bit as we level this here at this point. Now let's get on with it. And so we've got springs, and we used everything in the book trying to get to this position of this young man. And finally we went down with that, and this is the anterior block. We bite on that, and he had to do is chew it up here in the front part of the mouth for a while we reduced this one in size and increased the upper, and so it fit out over. You remember he had to, his bite was, the upper teeth went inside. So we're going to spread this out and shrink this one down and bring the upper teeth out over the lower teeth. We had to do that. So we're working with this double arch wire. Now this is this intruding wire right here, and this is the wire underneath here. It looks like about a 016 round wire that we're leveling and lining and doing all sorts of things with it while we're taking the whole group down with this little wire right here. It goes right down like this. It pulls this down, and it pushes this down, it pushes this up, and so we increase, and we're giving him a little more vertical now than he had. So let's go. Now when we get it, the upper arch expanded out past the lower arch, we worked with a restorative person, and he takes models of this and makes up where the teeth are going to go. Now you have to realize how small this upper was when we started the case out right here. And if I run back through that and look at the size, the upper arch was much smaller in there. And so now we've opened that. That's what we're primarily trying to do. And so we opened that up, and the restorative man, and we took the baby teeth out and put the permanent teeth in places where they should be. And then he was able to bridge that and use those permanent teeth to give him a full set of teeth. And that's been done in 1989. And I talked to this gentleman just this last year, and it's at 2300. In other words, it's been at 23 years here and 11 there. So it's been in over 30 years. He's still got his teeth. He had to have some added on later in here, but this gave him a full set of teeth. Now here it is with the x-rays, and this was 10 of 88 when we first saw this young man. And these are baby teeth, and he picked out the permanent teeth, and I think he's missing, he's 19 and 7. So he's pretty well grown when we started on him, and you can see the teeth in there. Let me get this back. Now, here he went to the restorative person, and he crowned these teeth, and these are teeth that he has left up here, and he's missing, I think he was missing 19 teeth. I'm not sure about that number, but we restored that mouth that way. Now this is no beginner orthodontic thing. You have to work with some restorative person and to get them to do this, but this is a wonderful result that you get going in at this time. And so we got this young man finished level of 89, looks like there. So it was just a short time. So there's the mouth at that point, and here is the bridge. The bridges, there are a whole bunch of them in there, and I know him personally, and he is here in the town, and we see him, and he's still got his teeth. And this is like 30 some odd years ago. So I thank you for watching, and if you're interested in doing this complicated stuff, well, go and take some courses. We have the AOS, or the American Orthodontic Society, has its national headquarters in Grapevine, Texas. That's where I used to live, and we taught courses there at our house in Grapevine, Texas, on the lake. And now the headquarters of the AOS is in Grapevine, and they'll be over in the park, the main Grapevine Park they've got there, and you can go to this place. The reason they selected it, we're having a really up-to-date lecture area made where we can teach 2 courses at the same time, and people can fly in, and there are 5 hotels within walking distance of this area. And you can fly in, or you can have the hotel pick you up at the airport. It's just a short distance from there to the airport, and bring you back out and take the course there. And if you want to really learn wire bending and how to start the cases off and do all this stuff, then come in and take courses there at the American Orthodontic Society. It's in Grapevine, Texas. So I'm going to close out now and say thank you for watching, and I'll hope you join this group and subscribe to our channel. Thank you for doing this, and I'll talk with you later.